everyone. I'm Barbara Ham Lee. There are all kinds of memes on social media about kids driving their parents crazy and vice versa as we all stay home to prevent the spread of coronavirus. They are amusing, but on a serious note, just how are our kids handling the stress of this pandemic? Will this major disruption to their lives impact their mental health and well-being? How do you know if your child is okay? What are the warning signs that there's a problem? And most importantly, what do we do about it? We have a child psychiatrist and a pediatrician joining us with some answers. The mental health and well-being of our children. We'll talk about it on Another View right after this news from NPR.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham Lee. Thank you so much for hanging in there and continuing to practice physical distancing, washing your hands frequently, wearing a mask when in public places, and staying home. These are all ways we can collectively help stop the spread of coronavirus. Now, there's lots of discussion about reopening the economy, and some states are allowing non-essential businesses like barbershops and beauty salons to reopen now. But here in Virginia, we are still under Governor Ralph Northam's stay-at-home executive order. So let's use our common sense, get all the facts, and make intelligent decisions about when to engage again. What we don't want is another wave of COVID-19 that could be worse than what we're already experiencing. I know it's tough, but we're tougher. So please continue to stay home and stay safe. So what does all of this mean for our children? Their lives have been totally disrupted. Homeschooling, no play dates, no dating for teenagers, making the best of this new normal. Some kids will do just fine. For others, maybe not so much. Joining me to talk about the mental and physical health of our children is child psychiatrist and member of the Chesapeake School Board, Dr. Pat King. How are you, Dr. King?
Hi, I'm well, and thank you for having me.
Thank you so much for being with us. And pediatrician Dr. Robert Johnson. How are you, Dr. Johnson?
Doing well today. Thank you.
Good. Thank you so much for joining us. So I want to ask each of you from your respective professions, what are you hearing from your patients? What are the children telling you? Dr. King, let's start with you.
Okay. So it's very much varied what we're hearing. Mm-hmm. The children who have mental health conditions oftentimes find it comforting to be at home, where there's less anxiety, less peer pressure, where they can tend to their schoolwork at their own pace. So some of them seem to be thriving under these circumstances. Mm-hmm. And then there are others, especially the adolescents and teenagers, who are struggling a bit because this is the time in development when they associate most with their peers and identify most with their peers. And they've been isolated from them. And they've also been isolated from a lot of the social activities that they engage in. So it's a very, very varied response. Mm-hmm. The younger children are faring a little bit better because most of their social interaction for toddlers and young children is with family anyway. So they're at home with their family members. They seem to be adjusting a little bit better. But it really depends on the developmental stage and the temperament of the child, as well as whether or not they have any pre-existing mental health conditions.
Dr. Johnson, what are your patients telling you when they're coming in to see you?
Well, I see mainly children who are less than 5 years old. We do see some older children, but they're few and far in between right now because of the we're limiting the visits to our office. Some of them do quite well. There are some who enjoy being home and are getting their lessons and whatnot through virtual means and so forth, but they miss going outside and doing the things that kids do. A lot of the activities that have been planned have been postponed or canceled, and that has resulted in children, especially some of the older ones, being upset. I know my myself, we had a ski trip all planned with a group of Boy Scouts that I mentor, and that got canceled, and they were quite upset about that. And some of them are having cabin fever, and they don't quite understand, why, why is what's the big deal? Why can't we do things that we usually do?
Are you finding a reluctance of parents to bring their children into the office for their normal routine checkups or for vaccinations and things of that nature because they're worried about COVID-19?
Well, in our office, we've taken quite a few precautions, and we see the children, the infants in particular, we see them in the morning. So we don't see any sick children. And right now we've been advising people who have respiratory illnesses, if they have signs and symptoms of the virus, we send them elsewhere to urgent care or, to emergency rooms. We will be seeing some children with respiratory illness maybe starting next week when things quiet down a bit.
Mm-hmm. So with and Dr. King, I'm coming to you in just a moment, but I wanted to ask you, Dr. Johnson, a lot of the symptoms of COVID-19 mimic flu-like symptoms or cold symptoms, et cetera. For little children, even though they're not the majority of the population, obviously they definitely are affected by this disease. And everyone has been seeing the stories about little Skylar Herbert from Detroit who passed away from COVID-19. But when should parents be concerned enough to call you and to say, do we need to check this out?
Well, they should have the same level of concern that they did prior to this situation. In other words, if the child has a respiratory illness and they're ill, they need to seek medical attention, at least advice over the phone. The fortunate thing now is that this time of year, respiratory illnesses are sort of waning, so there aren't that many kids with respiratory illnesses at this point. And the other thing is that there haven't really been that many pediatric cases of the actual virus. And that doesn't mean that there haven't been deaths and there haven't been children who've gotten seriously ill with the virus. And that's the case. Children have died. I believe that child that died in Detroit may have been a premature baby and had some pre-existing conditions, but there have been other children who've passed away who've had no pre-existing conditions. But basically, you do like you would with any other illness. If your child is really sick, you need to seek medical attention.
Yeah, I think some parents may get a little nervous because, or say, well, this is just a cold. I don't know whether this is just a cold, so I don't want to overreact, but yet I don't want to miss something. So you're saying err on the side of caution and call the doctor if you're concerned. Yes,
yeah, and the things that you are concerned about is pneumonia, and those symptoms are, pretty dramatic, and also high fever. Those are the symptoms that you would be concerned about, and you'd be concerned about those things regardless of, whether you're in the middle of a pandemic. Or so not. What I'm saying is that your level of alertness shouldn't be any different, at this time as before, and certainly things that you might have, ignored before, a high fever, you might have elected to maybe, treat it for a while at home before calling a physician's office. Maybe that's not such a good idea in this day and time.
And just for clarification, for young children, the ones that you see under the age of 5 and under, what is considered a high fever?
Well, high fever is above 102. I would say it's significant fever, and but temperatures can go anywhere from 104 to 105. More than 105 is usually a life-threatening infection of some kind, so fever by itself is not a critical symptom.
Mm-hmm.
It's the body's way of fighting off an illness. So it's more than just the fever. It's how your child looks and what your child is doing. I've had fevers of 103, 104 and felt fine, and then I've had fevers of 102 and felt like I need to go someplace and crawl underneath a rock.
Got you. So you have to pay attention to the whole thing. 440-2665 or 1-800-940-2240 are the numbers to call. We're talking with Dr. Robert Johnson, who's a pediatrician, and also with Dr. Pat King, who's a child psychiatrist. What concerns do you have about your children and how they are dealing particularly with this coronavirus pandemic? 440-2665 or 1-800-940-2240. So, Dr. King, we know that minority children, African-American children in particular, from our perspective here on Another View, already have a set of issues a lot of times within the household that they have to deal with, be it poverty or single parenthood or a variety of things that are going on. When a child recognizes that maybe their parent has lost a job or because of this, or things are changing in terms of the way the family dynamic is being handled, is that another trigger that parents need to pay attention to in terms of how their children are dealing with it to determine whether or not they need some additional help from a mental health perspective?
Right. Well, you're definitely right about environmental circumstances sometimes being a little bit different in our communities. But one of the most important things we can do within our households for our children is maintain as much consistency as possible and as much structure as possible for them. And the other thing is we have to be really careful about how much we share with our children. There are certain things that are just adult issues that shouldn't be discussed at length with children, like, our financial circumstances, bills not being paid. It's just like, based on a child's developmental state, we decide how we talk about sex. And it's different in terms of what you would tell a 7 or 8 year old versus a 15 or 16 year old. Mm-hmm. So I think we have to use the same degree of judgment and discernment when we talk about things in our households. And of course, when the environmental circumstances are more harsh, we're more susceptible to mental illnesses. And harsh environmental factors can certainly precipitate mental health conditions, and they can exacerbate existing mental health conditions. So we're always concerned when there are harsh environmental factors, and certainly this coronavirus is one of those. So when you compound that with stressful home environments, it definitely does create a situation that could be conducive to mental health issues. Mm-hmm.
So if a 5-year-old or a 6-year-old, 5 or 6-year-old comes to you and says, I'm scared about coronavirus, what should a parent say? How far should they go in terms of addressing that fear and that concern?
Right. Well, the first thing is to acknowledge their feelings. Mm-hmm. I understand that you're afraid. I know this can be a scary situation. It can be scary for all of us. But then you emphasize the things that you're doing to keep them safe. And that's why we are washing our hands and staying home and avoiding people who are ill or who have a bad cough. And that's why the schools are closed for your protection and your safety. And that's why I'm here, to make sure that you stay safe. So it's reinforcing that you're an authority figure and that, you're taking responsibility for the safety of your child. And that's what we do as parents in most of our circumstances that we experience in life. So acknowledging their feelings, allowing them to express openly how they feel, and making them feel secure, that the people who are in charge are taking care of them and making sure that the right precautions are being followed. And so the information that you give should not be overwhelmingly about how many people are dying and what the facts are and how many people have it. And, you want to create some balance. Yes, it's scary. However, these are the good things. These are the things that we're doing. So you really want to make them confident. And you also have to remember it's really important. We as parents set the tone for our children, and they learn how to react to things by the way we react. So we react in a panic, and we are hysterical and anxious and worried, then we can expect that some of that's going to carry over to our children. So when we have conversations with them about the coronavirus, it should be when we're calm and when we're not anxious in a worked up state, because that's just going to create more anxiety for our children.
Yeah, I was going to ask you about that, because if a parent is already feeling that type of anxiety, I mean, and if with your older children, is it okay then for you to be honest with them about how you're feeling about the situation too, or is it more the parent's responsibility to always put up that stoic, we're going to make it okay?
It's always important that we're honest with our children, and that the information that we provide for them is accurate. Because when we're dishonest, eventually when they figure that out, it creates anxiety for them because they're wondering what else we're being dishonest about. So yes, it is important to be honest. And depending on the age of the child, that determines how much information you give and what information you give. Now, older children, like teenagers, 15, 16 years old, they have so much information available to them. They probably know already as much as we know about this virus. Yes. It's absolutely fine, actually a good thing to acknowledge, I have concerns too, and it's scary for me. This is new for all of us. And then you go into, but these are the things that we're doing to keep us safe. So yes, honesty at any age with your children is going to be really, really important.
440-2665 or 1-800-940-2240. Call us and tell us how your children are handling the pandemic. Have you noticed any behavioral changes? Are you concerned about any of them? Give us a call, 440-2665 or 1-800-940-2240. Dr. King, I've heard about or I've read actually a couple of accounts of teenagers who have snuck out of the house to go see the girlfriend, or vice versa. How do we get our kids to, that's normal teenage behavior, I would say. But how do we get our kids to take this as seriously as they need to?
Yeah. And I think you can see, even when you look at some of the beaches in Florida and the young people who are on spring break, depending on, once again, the developmental stage, our adolescents and teenagers can feel invincible. And they can have reckless behavior, which is also part of that developmental stage. And so what we want to try to do is focus on not just their health, but how their behavior impacts other people, and how the precautions and restrictions that are in place are for their benefit based on the knowledge of professionals, and it's also for the safety of the people they love and care about, because their behavior can directly impact the health of others. I think you have to be very much aware of this developmental place and time, though. And teenagers can certainly be reckless, and their judgment is not always that sound. But it's up to us to continue to reinforce what kinds of behaviors we expect and why we expect them.
So teenagers are already moody and can be, and go through a lot of emotional changes. When do we know that it's more serious than just your normal teenage or a normal adolescent behavior?
Well, one of the main things you look for is a change in behavior. So So if you have a teenager who usually interacts with his family, and they're interactive around the home, and they engage in activities around the house, and then you see that they're not engaging anymore, they're not interacting, they're isolating more. You notice that their eating habits have changed drastically. Maybe they're not eating, or maybe they're eating excessively. If you find that their mood is drastically different, they're angry, they're hostile, even aggressive. If you have an adolescent or teenager who's neglecting their schoolwork, who previously was really conscientious about performing well in school, certainly if you see any self-injurious behavior, those should be warning signs. So any drastic change in behavior should be concerning. And in mental health, I don't know any of us who aren't still working. A lot of us are working virtually or doing telephone conferences, but we're still available. So if you really have concerns about your child at any age and their mental health and changes in their behavior, please, by all means, contact your mental health provider.
Mm-hmm. Mm-hmm. Dr. Johnson, do you find that parents, do they talk to you about their child's development from a mental health perspective before they go to a Dr. Pat King, for example, just in terms of the normal development of children? Do they focus on mental health?
Yeah, often we see these situations first. And the problem is we don't have enough professionals involved in mental health, and that's a glaring deficiency that we have. So they often come to us first. They're often referred, usually by the school, because that's where situations develop in the school. Mm-hmm. And then they come to my office, and I have to sort of figure out, how serious it is and where the referrals need to go past there.
So when you were in medical school, and you were deciding to become a pediatrician, was that a part of your training, or has this been something that has been placed more and more on the pediatrician to try to figure out what needs to happen to help children before they reach adulthood?
Well, the pediatricians are what you call primary care providers, mm-hmm. and psychiatrists and child psychologists are more or less consultants. So it's part of our training to recognize that there's a mental health problem or something that a psychiatrist needs to address. Mm-hmm. That's part of our training. What's not part of our training is to treat those conditions.
Got you.
Unfortunately, there aren't enough child psychiatrists, there aren't enough psychiatrists, there aren't enough counselors, yada, 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 the whole 9 yards. It's really, it's not a good situation at all. And what I've noticed in the years I've practiced as well, there's not a whole lot of communication between the mental health providers and myself as a primary care physician. When I first started, I knew, child psychiatrists, and they would write me letters and let me know what was going on with the patient that I referred them to. And now, I more or less tell the parents on the back of your insurance card, there's a number for mental health intake. You need to call them. And that's the last I'll hear about it until I see the child again for a well child visit and find out how things are going and so forth and so on. So it's a bad, it's really a need that's not being fulfilled right now. And there are a number of reasons for it, but it is not a good situation.
If you're just joining us, we're talking about the mental and physical health of our children during the coronavirus pandemic with child psychiatrist and Chesapeake School Board member Dr. Pat King and pediatrician Dr. Robert Johnson. So, Dr. King, do you find that on your side also? I mean, is there a meeting place where, particularly for our African American children, where our professionals need to come together to kind of cross-discipline to make sure that we can make sure our community is okay?
Yes. Okay. And point of clarification, I am actually trained as an adolescent and adult psychiatrist.
Sorry. Okay.
That's okay.
Thank
However,
you.
I do see children as well.
Mm-hmm.
And to answer your question, I think communication can always be improved amongst clinicians. And family practitioners are the number one most efficient specialty in medicine. And it's projected to be even greater in the next 10 to 20 years. But number two is psychiatrists. So some of the issue with communication is, like Dr. Johnson is saying, he's telling them, look on the back of your card and go and get some help, because there are so few psychiatrists that he has difficulty making a direct referral. So that's part of the problem. Communication is always easier when you know who you're referring to. And I think on the part of all of us, we should be reaching out more to connect all the dots, because the people we see are not a fraction of a person. They're a total person, and we need to make sure that we put all the pieces together in terms of treating them and making sure that they are whole. It's very difficult to treat just the physical part or just the mental part of a person, because all of that is part of who that person is. So we should all be reaching out and trying to communicate about our patients so that we have the big picture and so that we can serve them better. I just think that's imperative.
So mental health issues, psychiatry, psychology, all of that has always been definitely a touchy subject within the African American community. We can pray it away. We can do all these other things. We tend, or in the past have tended, not to treat what was going on in our minds the way that we would treat a broken arm or some other ailment from a physical perspective. Do you think, Dr. King, that that's changing now? Are people more and more recognizing that they need to take as much care of their mental health as they take of their physical health?
You know what? I think that stigma has impacted everyone, African Americans, Caucasians, Asians, across the board. But definitely in the last 30 years, oh my gosh, since I've been practicing, I can't believe it's been that long.
Wow.
I think things have really changed. I think there's not as much of a stigma. And certainly in the African American community, there is a stigma. But I also think that is associated with some of the issues that we endure in our communities. We see a lot of substance abuse. We see a lot of alcoholism. We see high incarceration rates. Our rates of suicide are growing. And I think a lot of that can be attributed to the fact that we're not getting the help that we need soon enough, or the type of help that we need. So I do think things are changing, but we still have a lot of work to do when it comes to mental health and acceptance of mental health treatment in the African American community.
440-2665 or 1-800-940-2240. We're talking with Dr. Pat King and with Dr. Robert Johnson about our children, meaning from 0 to 18, and how they are faring in terms of mental and physical health during this pandemic. Give us a call with your questions, 440-2665 or 1-800-940-2240. Dr. King, let me ask you a question. What do you think the outcome of this pandemic may be for this generation? Like when people that went through the Great Depression, for example, a lot of them either were prolific savers based on what they experienced as children, or they became hoarders in some instances because of the fear of not having. Any thoughts about what this may portend for this generation?
Well, there are a couple of factors that determine how we weather this. One of the major factors would be how long this crisis endures. We know that our children and adolescents are resilient, and we know that if we provide the right support systems, that they can thrive. So the hope is that this is going to be a very short-lived environmental trauma, and that we'll be able to get back on with our lives as normal. Certainly the vast majority of children and teenagers are going to fare well, and they're going to move on with their lives unscathed. And then there will be those who struggle a little bit more with insecurities and doubts and so forth. But if they get the proper interventions as soon as possible, it's very likely that they'll thrive as well. So I'm really hoping that this is not going to have long-term, lasting negative consequences for the majority of our children.
And Dr. Johnson, from a physical standpoint, from the perspective of taking care of ourselves physically, do you think there will be any major changes for the positive that may come out of this?
Well, I would hope so. There's so many lessons that can be learned, and this pandemic has uncovered a lot of situations in our society, and it's my hope that people learn from this. And I'm not sure that it's over yet. I'm not sure that it's not going to be with us for a while.
What do you hope they learn?
Well, for one thing, the fact that there's a discrepancy in healthcare, discrepancies in how people live, the fact that all of these high risk conditions and whatnot are more prevalent among African Americans, and the reasons for it. Those are some things that we need to learn. I think we need to understand how fragile this economy is, the way we live, how fragile it is. And we need to pay attention more to science and not disregard, what science teaches us.
Okay.
And when I look at this situation now with respect to our health, I think of global warming and the fact that we're ignoring that situation right now. And I wonder sometimes whether we will reach a point where we react when it's too late, when things come so catastrophic that we, then, see the light. And wow, it might be too late at that point. So I hope we learn a lesson from it. I mean, our president, number 45, said this was going to be nothing. It's going to be a flu. You have 15 cases today. Tomorrow there'll be 0. And I mean, I saw a patient today who felt that all the deaths were due because of people having too much diabetes and so forth and so on. I said, no, they're more susceptible. It's the virus, though, that's killing people. It's like if you don't see it, if it's not a family member that dies, you don't believe that we've lost over 40,000 people.
Yeah, education really is educating our people is really critical in this day and time.
And ignoring science and ignoring facts can get you in big trouble. Mm-hmm. And it's not new. I was reading a article in National Geographic, and I was shocked to find out there was an individual and a lot of people in the late 19th century who still believed the world was flat.
Yeah.
It was a theorist that believed the world was flat. He was from Oklahoma, so from his perspective, everything is flat, right?
Right.
But he, in 400 years after Columbus, sailed to the Americas, he still believed that the world was flat. And there were a lot of people who also believed that the world was flat. So I hope that people take science more seriously and listen to what people tell you, and not go on what your gut says or whatever.
Exactly. So, Dr. King, we all have to take care of ourselves. And we all, regardless of how healthy we are mentally, we are all suffer or have experienced anxiety around this pandemic because it's something that's brand new. It's very different. It has been a major disruptor. Can you give us some just general tips on how we can take a break, how we can rejuvenate our minds so that we don't fall into deeper depression or anxiety?
Yes, and may I also make a comment about the question that you asked a little bit earlier, and Dr. Johnson referenced as well. It is so important that we are honest and that we give accurate information to Americans about this illness. And misinformation can be devastating. And unfortunately, we do have some leaders who aren't informed, and the information that they give us is incorrect. And just as leaders in our households, we're responsible for being honest and giving accurate information. We really should hold all of our leaders to the same standard. And in response to what do I want to see come out of this that might be positive, I see a lot of positive things. I see that people are getting healthier. They're out walking their dogs. They're out riding their bikes.
Yeah, that's true.
People are setting up gyms in their homes. People are cooking at home instead of going to fast food restaurants. So I hope that out of this comes a heightened sense of awareness about our health in terms of our physical and mental health. And so what can we do? The gold standard is, Barbara, take care of yourself. This is an important time for us to make sure we get adequate rest, make sure that we eat healthy, make sure that we are active in getting exercise, and making sure that we set that example for our children while we're at home. This is the ideal time. And all of those things will help strengthen our immune system so that we can ward off cancers and viruses and things like the coronavirus. And it also will help to reduce levels of anxiety and make us less vulnerable to mental health conditions like depression and anxiety and a multitude of other mental health conditions.
And if we feel that we are in trouble, we should reach out and ask for help, correct?
Absolutely.
Absolutely. Well, thank you both so much for joining me today. I really appreciate it. That's Dr. Pat King and Dr. Robert Johnson. And we'll be right back.
When you think all hope is lost, find a new way just to move on and on and on and on and on.
And you're listening to the song by 8-year-old Matthew McFarland, who knows all about being frustrated with social distancing, and he decided to do something about it through song. Matthew joins us on Another View. Hi, Matthew. How are you? Matthew, are you there? Hello?
Hello.
Hi, Matthew. How are you?
Good.
Good. And your mom is with you also, Stephanie Bryant McFarland. How are you, Stephanie?
I'm doing well. How are you?
Good. I'm doing great. So tell me, Stephanie, what was going on the day that Matthew decided to create this song?
So I could tell that Matthew was kind of getting cabin fever. He didn't really understand the purpose of social distancing, so he had a harder time understanding why he couldn't go out and play with his friends, more so than his brothers did. And so I was noticing he was kind of posting little attitude checks in his room, just kind of reminding him to handle his emotions well. And so I had asked him, like, hey, how are you feeling about all of this? And so as he shared, I encouraged him that it might be beneficial for him to journal his feelings. And so he was like, well, okay, I think I'm going to write a song. And I was kind of like, oh, all right. He had never written a song before, but when I came home the next day from work, he had written his chorus and he sang it for me, and I was like, well, okay then. Here we go.
So, Matthew, let me bring him on to say, Matthew, kind of what was going through your head when you sat down to write the song? How were you feeling?
I was feeling kind of like...
Are you there?
sad.
Okay.
And I didn't know what to do while all this was going on.
So you just decided to put your feelings into words. Well, I tell you what, let's play a little bit of your song so we can hear your expression of what's going on today.
When you think all hope is lost, find a new way just to move on and on and on and on and on. Don't give up. People are there for you. Just move on and on and on and on and on. I'm sad and disappointed. Can't play with my friends outdoors. I'm frustrated. Can't do the things I've done before. But it's fine to be sad. I'll find other things to do until it's over. I can find new ways to play and be a good friend. We're all in this together. When you think all hope is lost, find a new way just to move on and on and on and on and on. Don't give up. People are there for you.
Wow, Matthew. That's a pretty heavy line when you think all hope is lost. Did you feel that way?
Yeah.
Do you feel better today than you did when you wrote the song?
Yes, a lot.
A lot? Oh, that's good. What do you think? Did you think writing the song helped you?
Yes.
So who put the music and the video together?
My dad.
So that was a complete family project. Wait, and your brother? Was your brothers involved too?
Yes.
In what way?
My older brother, he helped holding my dad's computer while we were at the park, doing part of it.
Okay, and you can find the video on YouTube, right?
Yes.
What's the name of it?
On and on and on.
On and on and on. So were you a singer before you wrote this song?
No.
No?
Well, kind of.
So do you think that you want to write more music? Is this something you want to do?
Probably.
Probably? You think so, huh? Now, where are you in school, Matthew?
I'm in third grade at Northern Shores.
Third grade at Northern Shores? Oh, okay. All right. So I'm going to talk to your mom for just a second now. And we are working with a phone system that kind of we have to go back and forth. So, Stephanie, you work for a health department. Is that right? are you concerned?
Yes, I do.
Were you concerned when you saw, well, number one, you took action, obviously, when you saw that your son was getting frustrated. But what are your concerns in terms of what you're hearing and seeing about the virus in Virginia and how we're handling things?
I think that as a state, and being cautious and proceeding with caution, kind of at the executive level, our governor is doing a great job there. I think that the social distancing measures and really just everybody kind of doing their own part, the goal is to flatten the curve. Mm-hmm. And as hard as that is, as uncomfortable as that is, as much as we want it to be over already, I think, just doing our part in protecting our own health and also protecting the health of others is crucial. I mean, we're still seeing numbers rise daily. And so, just trying to combat that, it's just super crucial for everybody to do their part.
Mm. Do you find it easier to help Matthew get through this or your teenage boys?
The two older ones are kind of unfazed. Matt is my quality time kid.
Okay.
And so for him, that time with his friends, the time, hanging out with neighbors, like that's super important to him. That's what he thrives off of. Mm-hmm. Whereas the other two, they're a little more flexible in that area. And so that's kind of the one that we've really had to watch from an emotional standpoint.
Yeah. So what kind of response have you gotten from the video and the song?
So when we first put it together and my husband posted it on YouTube, Matt's response was, "I hope we can get like a like and a view each day. That would be really good, huh, Mom?" And I was like, "Yeah, I think you're going to get more than that. We've got more family members than that." But I don't think that any of us really expected it to kind of get as much coverage as it has. And so he's enjoyed, even though he's a little shy, he's enjoyed kind of watching those numbers rise. And he's, even with the interview today, learning to kind of come out of his shell.
Yes, he did very, very well. Absolutely. Absolutely. So what do you think that your sons missed the most by not being able to go out and be with their friends? I know Matthew really likes to into what? Soccer.
They all play travel soccer, so I think they're missing their season for sure, and their teammates.
So you still have to go out of the home, or are you working from home?
I'm doing a telework rotation, so I'm home 3 days out of the week, and in the office twice a week.
Oh, okay. So how has the home dynamic changed through all of this for you all?
It's a lot more time all in one space. It's been really good for quality time because usually, during the week, after work, after school, when homework is done, we're dividing and conquering with soccer practices. Mm-hmm. I do miss the games on the weekend because that's like a joy of mine to see my kids do something they love and that they're good at. But it's a lot more quality time. We have a lot more conversation and discussion. So while it's a hard space to be in as a nation, I mean, really worldwide, I think that there's a lot of good that's coming from it, too. Yeah.
So the boys will hopefully be able to go back to school in the fall. Are there some habits that they've picked up now through this that you hope they maintain after things get back to quote unquote normal?
I think they are learning time management, especially with the kind of online schoolwork and deadlines for sure. And I think even for a lot of kids in elementary, learning that virtual platform now is going to kind of give them a step ahead later because we're digital. Right. I mean, we're a digital world. And so it's really kind of forcing them to get real comfortable with that.
Okay. Well, you must be a very, very proud mom. And I know that
Definitely.
Your whole family is very proud. Matthew, I want to ask you one final question before we go. And are you there, Matthew?
Yes.
Okay. So now, did your mom know that you could sing before you sang this song?
Yes.
Oh, she did. Oh, so this is not the first time that you've sung.
Yes, no.
Yes, no. But it is the first time you've actually written the lyrics to a song, right?
Yes.
Okay. Well, you know what? We're going to let you go, and I'm going to wrap up the show a little bit early so that everybody can hear the whole song. How about that?
Okay.
Is that good?
Yes.
Thank you so much for being with us. That's Matthew McFarland and his mom, Stephanie McFarland. We appreciate you all being with us here on Another View. And before we go, I want to tell you that former First Lady Michelle Obama is doing a read-along on PBS Kids' Facebook page every Monday starting at 12 noon. And so you can go to the PBS at PBS Kids on Facebook and listen to her read a book. And it's every Monday until May 11th. So if you want more information, you can go to at PBS Kids on social media. But I think that is just so cool, and yet another way for our children to get involved and to be able to continue to work on their reading skills. And thank you so much for joining us here on Another View today. You can share this program with a friend or a loved one by going to our website, anotherviewradio.org, and downloading the podcast. And please sign up for our eView newsletter. It's a once-a-week reminder of upcoming shows. Next week on Another View, Chief Larry Boone with an update on his Guns Down movement. Our theme music was composed and performed by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer, and Victor Bowen answered our phones. I'm Barbara Hamley. Please, everyone, stay safe, stay home, and join us again next Thursday at noon for Another View.
And disappointed, can't play with my friends outdoors. I'm frustrated, can't do the things I've done before. But it's fine to be sad. I'll find
And you're listening to 8-year-old Matthew McFarland, the writer and the singer of On and On and On. Have a good weekend, everybody.
I can find new ways to play